occupational therapy student. I'm here with Mr. Caleb. So we just want to interview you and find out some typical things that you do with these patients. So what are some specific things in the ICU that are important to consider before treating these patients?
Level of injury, how sick they are, the level of illness is really important. Depending on if they have any fractures or specific medical issues, going for surgery, requiring a lot of units of blood, things like that.
Are there any specific like lab values or anything you like to look at from the medical chart before you go in?
I mainly go with what the nurses tell me, because like in the ICU, the nurses pretty much tell you see the patient or don't see the patient. Because sometimes they could have a low number on something, but you still see them.
Right. Okay. So what are some overarching goals that you have for these patients?
After the initial evaluation, we want to look at movement, range of motion, if it's passive, active, or if they need assistance with movement. Look at positioning in the bed. Sometimes we'll work with the nurses on proper positioning, either wedging or just pressure relief. I'll look at splinting, if they need an AFO for foot drop, if they need something for wrist drop.
What about when is it appropriate for these patients to be mobilized?
If somebody's intubated, they'll need to, well, one, be kind of medically stable. I mean, in the ICU, it kind of varies. They need to be alert, following at least some commands, if not all. And some of it's judgment on safety. If you think they're going to be safe enough to sit up, then you also have to look at vitals. If their blood pressure's dropping when they're moving, if they're sitting up, look at oxygen. The oxygen rate is high or low on the saturation.
In your opinion, why is occupational therapy important in the critical care setting?
Multiple reasons. One, you want to decrease the negative effects of prolonged bed rest. People are usually in bed for a long time and then don't get stimulated or don't get a chance to get up. Looking at improving our outcomes, we find that the sooner that we work with some of our patients in the critical care tower, the sooner we get them out of the ICU as well as out of the hospital. Decreasing complications from any kind of critical illness, whether it's pneumonia, DVTs, blood clots. Just trying to get the patient up and moving.
And when is it not appropriate to see patients in the ICU?
Life issues, if they're toward the end of life on things, looking at their medical severity, if they're really sick, we won't be able to see them. And then if they have a poor prognosis, then usually we won't be seeing the patient. Only reason we'll be seeing them is just for positioning or teaching the family things they can do to keep the patient comfortable. Oh, I forgot to mention about ICU delirium. Sometimes we'll see that our patients get really agitated or irritated. Their sleep-wake cycle is thrown off from being in the ICU for a long period of time. So sometimes we'll have to do certain stimulation techniques to get them back in their cycle, whether it's during the day having the lights on, blinds up, TV running, as well as having staff and family members reorienting the patient to where we're improving their cognition.
My name is Taylor and I'm an occupational therapy student. Today I'm going to be showing you some techniques to use when treating patients in the ICU. Today we're here with Miss Lawson, and she has approved that this is okay, that we're videoing her and telling you some history about her, what's been going on. So Miss Lawson has always had really bad asthma, and she's had a few hospital stays in the ICU from some respiratory distress. Each time she has been ventilated. So this morning they actually weaned her off the ventilator, and she was on the ventilator for the past week. So since Miss Lawson has had previous hospital stays, we know her typical length of stay, so we do passive range of motion while she's on the ventilator, or maybe even some early mobilization if she's cognitively intact for that. Since we are not hooked up to the ventilator anymore, we just wanted to show you some positioning techniques that we were using while she was on the ventilator. When we come in, we always want to look at positioning of the arms and how she's positioned with her body in the bed. So a lot of times we try to gather as many pillows as we can in the hospital because they're very rare to come by. This is a little big, but the colors are pretty, and you know, if her eyes are open, it might be a good stimulant for her. So we want to make sure that her arm is not in a dependent position while she's on the ventilator. And we want to just make sure she has proper positioning and that it's a position of comfort. Scoot her up in the bed also. By using the draw sheet, I would have a counterpart with me and we would roll the sheets up, pull tight, get a good grasp, and pull her up in bed. Most times in the ICU, it's going to be co-treated, so that's something to remember in the future. All right, now that Miss Lawson is awake and she's ready to get out of bed, we're going to lower the bed as low as it will go before we start bed mobility. And Miss Lawson, if it's okay with you, I'm going to pull your covers down. We've been sitting her up on the ventilator, but today's the first day that she's going to try to do most of the work by herself. So just like we typically do, I want you to start scooting your legs towards the edge of the bed. Kind of walk them over. Good. All right, can you turn to your side a little and push this elbow through the bed. Push your body up strong. You might be a little dizzy. Miss Lawson is kind of a professional now at what she does. She knows how to scoot her hips. Now that Miss Lawson has kind of gotten over feeling dizzy and she's kind of comfortable and relaxed, we're going to let her put on this robe just like a jacket, okay? Okay, now that she has her gown on, we're going to do some socks. These are special grippy socks. And you do as much as you can, and when you need assistance, I will help you. That I'm putting on you. You've had it on before, but for everyone that hasn't seen one of these before, this is just for providing extra safety for her and also for me as well when we're getting ready to do functional mobility. Okay, now I want you to use both hands on the side of the bed. Let's get your feet placement good. All right, now I want you to push hard on 3 with their hands. 1, 2, and 3. Push hard and stand. Good. And I'm keeping a hand on her. This is the first time that we're standing. Typically, like I said, we'd be co-treating this with PT, so they would be in here as well.
And I'm an occupational therapy student, and today I'm going to educate y'all on some stimulation techniques for occupational therapy in the ICU. As we've been recently informed, our patient here has had some respiratory issues. Delirium is a common problem that they see in the ICU. This causes the patient's sleep-wake cycle to get thrown off, which means that the patient thinks that it's daytime when it's actually nighttime. So while Miss Lawson is about to eat her lunch and watch some TV, I'm going to do some visual stimulation. So we're going to raise the blinds of her room. That's also some auditory stimulation. I'm going to raise the blinds so that she also gets some stimulation from the outside overlooking her hospital room window. And what she can see is there's daylight sun coming in. It kind of helps her orient to her time of day. And what they like to do is afternoon. What they like to do in the ICU is to keep the blinds raised and the sunlight to come in about 10 hours out of the day to keep the patient oriented. And also orientation is great for the parents to continue to do with the patient, just kind of letting her know where she is, who she's with, and why she's there. The range of motion was done while she was intubated and sedated, but now that her therapy treatment has progressed, I'm now going to show her some different techniques and exercises for strengthening to help with her endurance. So this is a TheraBand, and I kind of stepped it up from the red to the yellow. The yellow is a little more, has a little more resistance. So what we're gonna do is I'm gonna have Miss Lawson take the end of this This also works on some touch stimulation. She's getting a different texture and it has a little give to it. So we're going to do some in and out rotations, and then we're also going to do some bicep curls. So first, curl in, and you do this about 10 times as she's been educated before, just working on her endurance and her strength. And now that I've moved in front of Miss Lawson, we're going to have her do some external rotation. So as I have taught her and guided her before, she's going to take her arm out, and we're going to do 10 reps of each. Thanks for watching.
I'm Taylor.
I'm Ida.
Call us anytime. ICU.
And I'm Callie.